Today we'll start topic related to respiratory disorders in children. So what are respiratory disorders? The infections or any abnormalities which we will find in respiratory tract are known as respiratory disorders. So we have to assess for the respiratory disorders first. Respiratory assessment. How can we assess the respiratory disorders? Anyhow, we are going to check the vital signs, isn't it? We will check the respiratory rate in the vital signs. So we have to check the vital signs 1 full minute. Okay. So infants are called as obligate nose breathers. ऑब्लिगेट नोज ब्रीथर्स. क्यों ये ऑब्लिगेट नोज ब्रीथर्स कहा जा रहा है? सो दे प्रिफर ब्रीथिंग थ्रू देयर नोज दैन रादर दैन द माउथ. सो जब वो बनाया गया है उन लोग ऐसे है कि जो नोज से ब्रीथ करने के लिए बनाया गया. सो दे प्रिफर टू ब्रीथ थ्रू नोज रादर दैन द माउथ. However, they are able to breathe through mouth also, but only when there is a nose blockage. For example, usually some बच्चे जब cry करते हैं, when they cry, they will take breath through their mouth. Okay? इसी वजह से वो obligate nose breathers कहा जा रहा है. They are called as obligate nose breathers. So we have to identify signs of respiratory distress. कैसे पता चलता है if there is respiratory distress? So there will be nasal flaring and apnea, cyanosis. So these are the signs of respiratory distress. Next, if we listen to the breath sounds, there will be different sorts of sounds we can observe. First, like stridor. Stridor is nothing but the shrill harsh sounds in the lungs. And if you see ronker, they are low pitched rattling sounds, like we feel like the baby is snoring. Okay. And if you see wheezing is in Hindi ऐसे बोलते हैं गरगराहट. So high pitched whistling sound you can observe. And next is we have to check for the quality of respirations. ऐसे है कि हम क्वालिटी कैसे बोल सकते हैं? लेबर्ड रेस्पिरेशन, वो बहुत तकलीफ़ होता है उन लोगों को रेस्पायर करने में. एंड गैस्पिंग. सो गैस्पिंग इज़ द बहुत तकलीफ होने के बाद दे विल अनेबल टू टेक इन द एयर. सो दैट इज दे विल गैस्प. एंड obstructed respiration also we can see. So these are the terms we have to use for the quality of respiration. Quality of pulse we have to check. The pulse rhythm we have to check, either regular or irregular. So this we have to observe. Next, check for skin color of the skin. We have to check whether it is pale, whether it is cyanotic, whether it is mottling. Mottling is nothing but red spots will be appeared on the skin. Okay. Next, cough. About cough we will see croppy cough. There are different types: croppy cough, loose and wet cough, dry cough. So croppy cough is nothing but it is similar to barking sound, harsh barking sound you can see. Wet cough or loose cough, if you see, it is nothing but the productive cough. So productive cough, it means there is a production of mucus or phlegm. mucus or phlegm it will produce. And in dry cough, if you see, there is no production of mucus. It is just produced because of the airway irritants, like if we inhale some chemicals like smoke, gases, और sometimes अचानक हमको खाते समय या कुछ पीते समय अचानक जो कफ आता है, दिस इज़ प्रोड्यूस बिकॉज ऑफ सम अचानक से जो एयरवे में ऑब्स्ट्रक्शंस होता है उसको क्लियर करने के लिए ये जो कफ होता है उसको ड्राई कफ बोलते हैं. वी विल कॉल इट एज ड्राई कफ. And we have to also see the behavior changes. Behavior changes nothing but how the baby is looking like. If the baby is fast breathing or restless, I mean restless, ये हम कैसे पता चलता है? If the baby is infant, they will cry. So from this we can understand they are restless. And a lethargic breathing, the breathing pattern will be very slow. Okay. And we can also see for change in LOC. LOC is level of consciousness. LOC is level of consciousness. So we have to check for the level of consciousness of the babies. Next, if we see signs of dehydration. Signs of dehydration, we have to check for input and output. Input and output. If there is respiratory disorder, there will be low input and output. Skin turgor, the skin turgor will be thickened, scaly skin, so it seems like dehydrated skin. Okay. Check abdominal and sternal muscles also. We have to check the skin of the abdomen and sternum also becomes scaly, tightened, contracted. Okay. From this we can observe the signs of dehydration which will be relating to respiratory disorders. Lack of tears we can see. Lack of tears in the older children we will see as a sign of dehydration. Next, nasal flaring. So this is one of the important observation we will find in respiratory distress cases. So how we can find out? If we see the left picture, it is a normal nostrils. So the nasal flaring will be, the nostrils will be widening, as we are seeing widening of nares ड्यूरिंग इंस्पिरेशन. जब हम इनहेल करते हैं एयर तब क्या होता है, जो नॉस्ट्रल्स यहाँ राइट साइड पिक्चर में देख रहे हैं वो वाइडन हो रहा है. सो देयर विल बी वाइडनिंग ऑफ नेयर्स. सो थ्रू दिस वी कैन ऑब्जर्व फॉर रेस्पिरेटरी डिस्ट्रेस. इट रिप्रेजेंट्स एन इंक्रीज्ड एफर्ट बाय द इन्फेंट टू ब्रीथ. सो ये नेज़ल फ्लेयरिंग जो है, जब हम एक बेबी को नेज़ल फ्लेयरिंग होते हुए देखेंगे तो वी कैन अंडरस्टैंड द बेबी इज़ टेकिंग एफर्ट, मीन मेकिंग एफर्ट्स टू breathe. So with this we can take necessary precautions, like if we see in hospital setup there is, we will go for CPAP advice or ventilation. Okay. Next, if we see about the retractions, observe for the retractions. So in this we should note exact location of retractions, because retractions at subcostal or substernal region or location, it will result from lower respiratory tract disorders. Lower respiratory tract disorders.